Thank you, Madam Speaker. The Honourable Prime Minister, the Honourable Leader of Opposition, Honourable Cabinet Ministers, Honourable Members of Parliament, members of the public in the gallery and those watching these proceedings from the comfort of their homes, and a very good afternoon to you all. Madam Speaker, I rise today in support to endorse and commend the 2018 and 2019 budget that was presented by the Honourable Minister for Economy on Thursday, the 28th of June 2018. Madam Speaker, the budget presented is a budget built for every Fijian family, everywhere in Fiji, because for us, all Fijian families matter. Madam Speaker, as the Minister for Health and Medical Services, I warmly welcome the budget and thank the Honourable Minister for my ministry's allocation for 2018 and 2019. On that note, Madam Speaker, I would also like to thank our Honourable Prime Minister for his visionary leadership in promoting unity and an inclusive society for all Fijians. Madam Speaker, since its announcement, the 2018 and 2019 budget has received widespread praises and has been widely welcomed by the general public. Madam Speaker, it's a progressive budget as it incorporates strategic policy innovations and new initiatives that is uniquely targeted towards the empowerment of all our Fijian families. Madam Speaker, this budget is built on the achievements of the past and it should be viewed in totality, which signifies our government's comprehensive approach for national development. Madam Speaker, coming back to the Honourable Shadow Minister's address this morning, I'd like to thank the Honourable Shadow Minister for Economy for his lengthy address this morning. Madam Speaker, the Honourable Shadow Minister's delivery alluded as if all was gloom and doom in Fiji for all Fijians. I urge the Honourable Member to remove his tinted shades to see and recognise the realities that exist in Fiji today. Prosperity and progress. Madam Speaker, Fijians are happier more than ever before. Fijians are secure more than ever before. Madam Speaker, we are united and resilient more than ever before. And Madam Speaker, we are progressing more than ever before. Madam Speaker, the reasons for me saying that, Madam Speaker, we have a government that really cares and understands the needs of our people. We have a government that has policies and initiatives that includes every Fijian, because for us, every Fijian matters. Madam Speaker, we have a government for whom it is all about people. Madam Speaker, this government is committed to serving all Fijians, and this government is all about fulfilling their promises and putting policies into action. Madam Speaker, our people know that the future of Fijians is now more rosier than before. Thank you, Madam Speaker. Madam Speaker, coming back to the Ministry of Health and Medical Services budget, the 2018 and 2019 budget is clearly aligned with my ministry's vision for building a healthy nation through developing healthy Fijian families by empowering Fijians at all levels of healthcare and services. The total allocation in the 2018 and 2019 budget for the Ministry of Health and Medical Services is $335 million. This comprises of $260 million allocation for operating expenditure and $60.5 million for the capital expenditure and, of course, VAT of $14.5 million. Madam Speaker, there are a total of 6,363 staff who administer our 3 divisional hospitals, 19 sub-divisional health facilities, 2 specialized hospitals, St. Giles and Tamavua Tomi, a total of 86 health centers and 100 nursing stations. The operating expenditure budget, Madam Speaker, will meet both medical and non-medical expenses. Madam Speaker, I am pleased to report to the members of this August House that through 2018 and 2019 budget, the government has delivered an increase of 13.9 million Fijian dollars that reflects on the government's significant investment to upgrade and expand our existing health facilities, to construct and equip all our health facilities in Fiji with modern medical equipment and resources. Madam Speaker, it is also mainly attributed towards an increase in recruitment of new positions of allied and technical staff. These positions will enable us to ensure prevention and diagnosis and treatment of a wide range of illness and health conditions. Madam Speaker, the increase in funding for hiring of locum doctors. Currently, we have 31 general practitioners who work as locums and 9 specialists, and they cater for the current demand for shortage of doctors and specialists. There is an increase from $500,000 to $2.5 million to hire these locums to practice within our health facilities. Madam Speaker, in addition, a total of $47.6 million will be provided by the Ministry of Civil Service to fund doctors' salaries and training. Therefore, the overall health sector budget amounts to $382 million. Madam Speaker, enhancing healthcare accessibilities has been one of the key strategies for health sector development. As such, the introduction of general practitioners to set up clinics directly in Fijian communities will greatly boost the accessibility of health services to rural and maritime areas. It directly addresses the greater inequalities in the densities of health workers at provincial level compared to the divisional levels in Fiji. Madam Speaker, furthermore, facilitating general practitioners' clinics in remote and peri-urban areas significantly increases access to health services for the general population. Equity in access is also improved for the remote or rural peri-urban dwellers. That is, the same services offered at urban areas by general practitioners will now be made available to those rural populations and, of course, subsidized by the government. Madam Speaker, an important element in achieving this objective is raising the doctor-patient ratio to 1 doctor per 1,000 people as per the WHO standard. In 2009, Madam Speaker, the doctor-patient ratio was 0.44 to 1,000, and in 2014, it improved to 0.6 to 1,000, and in 2017, the patient-to-doctor ratio further enhanced to 0.94 to 1,000. We expect further improvement in this as doctor-patient with the increased numbers of graduates currently trained in our 2 medical schools. Madam Speaker, it is indeed a historic recognition that for the very first time in 40 years of their existence, the network of community health workers are now recognized better. Never before, Madam Speaker, did we see this recognition given to our community health workers. The new allocation in the 2018-2019 budget, $4.6 million, will go towards increasing the allowances of close to 1,800 community health workers in Fiji, who previously received about $50 per month. Now they'll be receiving $200 per month. Through this, Madam Speaker, we will be able to strengthen our collaboration between the community health workers and the ministry to coordinate capacity building and more training opportunities. They will also be equipped, the community health workers will also be equipped with basic medication and equipment that will enhance their role to improve the services within their communities. Madam Speaker, at this point, I would like to acknowledge the work carried out by the community health workers as they play a very vital role in terms of health advocacy, health promotion, community profiling, community health mobilization, basic first aid referrals and follow-up. They are the agents to empower communities, women, children, youths, elders, young and old, and they educate and inform them on various health-related issues. Madam Speaker, the government continues to build on infrastructure developments for the health services that ensures that every Fijian community has efficient accessibility to modernized health facilities that provides them with quality and timely health care. Some of the new facilities that were opened last year includes the Lotoka Emergency Department and the new operating theatres, the new Makoi Maternity Unit and the Waimaru Health Centre in Ra, which was opened early this year. Madam Speaker, these are modern facilities and they are making significant changes in the lives of the Fijian families that seek health services there. Madam Speaker, moving on to some other new health facilities for the year, the new Bar Hospital, which is a state-of-art facility, is completed, and this has been made possible with a budget of $34 million provided by the government. It is expected to be handed over by the end of this month. Madam Speaker, next is our new Nakasi Health Centre, which is a Level A health centre and has been built with a budget of $4.1 million. We expect it to be open and operational by the fourth quarter of this year. Once operation, Madam Speaker, it will provide medical services to the Greater Nakasi area and will also ease the load from Valelevu and also the Nosuri Health Centre. Madam Speaker, the third project in progress is the extension of the CWM Emergency Department, which will create more bed spaces for one of the busiest emergency units at our major divisional hospital here in Suva. It will greatly boost the hospital's capabilities to attend to emergency cases in an efficient way. A total of $250,000 has been invested into this much needed extension services. Madam Speaker, these new developments will no doubt benefit all Fijians to have access to modernized and state-of-art health facilities. It will enable our ministry to intensify our reach out in terms of delivering efficient and quality health services in Fiji that every Fijian truly deserves. Madam Speaker, the development of health facilities will continue with the 2018 and 2019 budget allocation of 60.5 million Fijian dollars for capital development within our health sector. These include $11 million towards the extension of the new Colonial War Memorial Hospital maternity ward, which will be the state-of-art and first-of-its-kind facility dedicated to women of Fiji. $11 million is allocated towards the construction of the Navwa Subdivisional Hospital, which will serve over 10,000 Fijians in the Nandronga Navwa province. $1 million has been allocated for the construction of the new Londoni Health Centre in Londoni to ensure high-quality health services are delivered and provided. $500,000 has been allocated for the much-needed extension of the Korovo Hospital, $3 million to upgrade the hospital's operating theatre and X-ray capabilities at the Lotoka Hospital, and of course, $2.5 million towards the upgrade of Valelevu Health Centre to a subdivisional hospital. Madam Speaker, apart from the infrastructure development, allocations have also been made to accommodate the transportation needs of those Fijian families in the maritime and rural areas. There's an increased allocation of $500,000 in the 2018 and 2019 budget. These funds will be directed towards purchase of new boats and outboard motors, repair and maintenance of boats to assist in improving accessibility to primary healthcare services in those hard-to-reach places. Madam Speaker, the 2018 and 2019 budget has allocations for the equipping of our health facilities and with modern state-of-art equipment and technologies that will empower our medical professionals to make accurate diagnoses, to ensure clinical accuracy and offer quality treatment. I'm pleased to say that a total of $9.5 million has been allocated to purchase new dental and biomedical equipment for urban and sub-divisional hospitals and a new MRI machine for CWM Hospital through the $4 million allocation, which means more Fijians will be able to access quality service, and it will enable our medical professions to save lives. Madam Speaker, moving on to the most awaiting service, and that is the treatment of kidney diseases. Chronic kidney diseases, Madam Speaker, affects about 10% of the world's population and is amongst the top 10 causes of deaths in Fiji. It is a milestone achievement, Madam Speaker, for the very first time for any government to subsidize the cost of kidney dialysis and also to establish the kidney dialysis centres, one in Suva, one in Nandi, through an allocation of $2 million. The new centres will complement the current services provided by privately funded facilities, and it will, of course, ensure that there is an increased availability and accessibility of this service to our people. The National Kidney Research and Treatment Centre is currently in development, and its operationals will commence in the very near future from a temporary location. Plans are underway to commence the National Peritoneal Dialysis Program, and 2 of our nurses have been trained in Australia specifically for this peritoneal dialysis treatment. Madam Speaker, improving accessibility of services available and subsidizing the dialysis cost plus research goes a long way in ensuring equity, accessibility and affordability to our Fijians with non-communicable disease complications. A total of $3.5 million will be used to subsidize the cost of treatment for patients currently on hemodialysis treatment and $2 million towards infrastructure and specialized equipment. It would be for the first time for Fiji to see the dialysis cost being subsidized to $150 per session, and those with household income under $30,000 will only pay 50% of the treatment cost. This significantly eases the financial load on families and, of course, will significantly reduce the emotional and mental burden that families and patients carry with them from these diseases. A group of kidney patients visited us last week after the budget announcement, Madam Speaker, and expressed their heartfelt appreciation to the government for its swift response and commitment for addressing their much-awaited plight. Madam Speaker, having said that, I would still like to emphasize that dialysis is not a lifestyle option. It is not only costly, but it is also time-consuming. We all need to emphasize to all our Fijians the importance of avoiding NCDs, or if they are affected, they need to comply with their treatment regime to avoid their conditions deteriorating. It is possible to live for many years with well-managed diabetes without the need of dialysis. Madam Speaker, moving on, for patients who need specialized medical services that may not be available locally, the government, through the 2018 and 2019 budget, has increased the overseas treatment budget from $1.3 million to $2 million for the next financial year. The referral of patients abroad remains an integral part of the services that the Ministry of Health and Medical Services facilitates for all our Fijian families. Patients are referred abroad for treatments that are highly technical and complex, in treatment modalities that we presently cannot offer in Fiji at our hospitals by our locals or by the visiting medical specialist. Madam Speaker, for the first time, furthermore, the health needs of people with albinism are being brought out of the shadows and specifically addressed with the allocation of 60,000 in next year's health budget. These funds will be used for the purchase of items such as sunscreens to prevent skin cancer for people with albinism and who are not able to afford it. The Health Ministry will continue to work with other ministries and non-government organizations to ensure that no one is left behind, and this includes our Fijians living with albinism. Madam Speaker, the Health Ministry's work in reaching out to Fijians and assisting them to protect them against NCDs and CDs by encouraging every Fijian to lead a healthy lifestyle and seeking to eliminate the risk of unhealthy environment is too rarely acknowledged, but it is indeed vital work, and the work this budget will enable us to sustain and continue. A total sum allocated to the public health services in the 2018 and 2019 budget is 12.7 million Fijian dollars. I am pleased to say that it has been increased by 4.9 million from the 2017 and 2018 budget. This includes an increase of 100,000 for dengue allocation. The public health allocation will significantly support the ongoing work in many program areas. Just to highlight three: enforcement of tobacco control, HIV/AIDS prevention control, and adolescents' reproductive health control. Madam Speaker, I am pleased to say that the Health Ministry's ongoing efforts to build a healthier Fiji will be greatly assisted by the 15% excise taxes on sugar, beverages, alcohol, and tobacco. The increased tax on sugar beverages will impact people's choices, we hope, thereby reducing the consumption of sugary drinks that will significantly assist in the prevention of obesity and diabetes. It will also enable families to save money and invest in making much healthier choices. Madam Speaker, the reduction of import duties from 5% to 0% on imported fruits and vegetables shows our government's continued unprecedented commitment to reduce the common risk factors associated with NCDs in Fiji. This will expand opportunities for Fijian families to access a variety of fruits and vegetables at a more affordable price. It will also broaden purchasing choices for the consumers and help them increase their consumption. Investing in the better management of NCDs is critical through proper diagnosis, screening, and treatment. These are the key components to our response to our NCD in Fiji. Madam Speaker, it is also encouraging to note from the health perspective the increase in paid maternity leave from 84 working days to 98 working days, which provides additional 14 days for mothers to take time off from work in preparation of the birth and the care of the child. The new maternity entitlement leave, Madam Speaker, will further enhance early initiation and exclusive breastfeeding that sets the stage for healthy growth and development of a child, and of course largely reduces the risk of childhood obesity and diabetes. Madam Speaker, these policies reflect the government's compassionate approach to the development and welfare of many Fijian families who hold a special occasions such as rearing of a child to their hearts. Madam Speaker, moving on, the Ministry's efforts to combat communicable diseases, there are now developments incorporated in the next budget of $1 million for a new modernized facility to be developed for the Fiji Center for Communicable Diseases, and a total of $250,000 has also been allocated for upgrading of the National Public Health Lab at the Fiji Center for Communicable Disease Control. Madam Speaker, the budget provides ongoing funding for our health customer care line, which was launched last year. Madam Speaker, the whole rationale behind this customer care center is to listen to our people. It shows here that we have a government that is listening to the voices of our people. And we make every effort to have their concerns addressed. And Madam Speaker, that's the way forward to improving our service delivery. Madam Speaker, as for the 2018 and 2019 budget, the free medicine programs will continue. And this was launched in 2015. A new restructure will allow the retail pharmacies now to procure their own medicines in this program list, and of course the governments will reimburse accordingly. This will ease the availability of medicines that will enable our beneficiaries to access the medicines listed, and of course we have a 142 list of medicines that are now provided to all those citizens earning below 20,000, and at the moment we have 31,000 Fijians who are benefiting from this free medicine program, and we encourage people to take advantage of the continuous free medicine registration drive and register to access to this medicine. Madam Speaker, I'm honored that the government has seen fit to support our efforts and those of the many hardworking staff in the Ministry of Health and Medical Services by providing us with a substantial increase in the resources at our disposal. And Madam Speaker, I'd like to thank and acknowledge all our development partners who have partnered with us.
Thank you.
Thank you very much.